Hi, everyone. Let me start by taking this mask off. Good afternoon, and congratulations to all of you, the class of 2020. As the culmination of a long journey filled with late nights, hard work, lots of reading, and a whole host of other things, this moment is well-deserved, and I hope you will enjoy it. And congratulations and thank you to Dean Scheinman, as well as his leadership team and faculty, who have so diligently worked to ensure that each of you completed all the requirements to secure your degree. Given the unusual environment we are in, your teachers and school administrators have been pressed to call upon their creativity and flexibility and are particularly deserving of our gratitude. Today is a time to celebrate your achievements. Achievements that come during the most trying and unprecedented times, but if anything, these circumstances have demonstrated your adaptability, your grit, and resilience, all qualities that will serve you well as you enter your medical career. So, while there hasn't been a recent situation that approaches the level of change you've experienced, it is important to remember that change itself is inevitable. This is not the first, and it won't be the last, that your path takes an unexpected turn. It's how we adapt and react to such times that matters. You can either choose to make plans or to have principles. That choice will make all the difference. There's an old saying that says, the universe has a way of laughing at your plans. As most adages are, this one is true, as I've realized personally myself. Elaborate plans often falter. The path of life will disappoint people who insist on drawing a detailed map. Developing guiding principles, however, will support you through the tough times, the good times, and the bad times. Holding fast to your principles is a constant that can guide you regardless of changing circumstances. You can trust them to help you fill in the details, to shift the focus from what you will do and instead to who you will be. Today's pandemic has already delivered a master class in this truth. Reflect on your own response to the events of the recent months. It must have been difficult to say goodbye to carefully laid plans for match day and for commencement. Yet here you are, getting your degree and preparing to begin the next stage of your career journey anyway, which for most of you is residency training. Clearly, the details and plans changed what you may do, but they have not changed who you will be in times like these. The principles that guide you allow you to adjust and adapt in a complex, uncertain, and ever-changing world. They are the only constants you will have, so choose your pillars carefully and the details will reveal themselves as you go. Let me offer some ideas about resilient principles that have served both me as a physician and our entire Geisinger system well. Putting the patient first will never fail you. You may be aware that Geisinger launched a new strategic plan just as COVID was starting to rear its head on the other side of the world. The plan, simply stated, was to make better health easy for everyone. Not health care, but health. Not just for the privileged, but for everyone. Translating this concept into reality through actions had just begun when the virus hit in our state and region. As you can imagine, the crisis touched off quite a bit of change in our health system, and many plans had to be put on the back burner. But the guiding principle informing our vision did not fail us, and that's because making better health easy is all about patients and their needs. In the pre-COVID world, that principle may have been executed differently, but what didn't change was the questions we asked ourselves when the pandemic hit. What do our patients need? Where can we deliver it? How can we ensure not only the best care, but also the most effective prevention? Health instead of healthcare. The answer was to ramp up telemedicine, which we did quite successfully. Telemedicine kept vulnerable people out of crowded emergency rooms and clinics, while at the same time providing the appropriate care and monitoring required. It also allowed us to redeploy resources to areas of greatest need. Our patient-centered principle helped us to meet the challenges of the moment in the best possible way. What will day-to-day health efforts look like when COVID abates? We don't know the answer yet, but we do know that maintaining a singular focus on patients and their needs will never disappoint us. View each patient as a whole, unique individual, and our role as partners to maintain their total health. Another of Geisinger's pre-COVID plans was to accelerate our focus on keeping entire communities and populations healthy. And if COVID taught us anything, it is the importance of population health. The pandemic demonstrated the life-saving preventive value of vaccines to the public in real time. People recognized that their ability to once again experience the joys of the stadium or the concert hall rests entirely upon an effective vaccine. There's also a new appreciation for the importance of healthy personal habits that prevent underlying conditions, a phrase that popped up repeatedly in COVID news coverage. Again, we don't know how long these particular lessons learned from COVID will remain with the public, but the important thing is that you retain them, no matter your specialty. Never forget that you are treating a whole and unique human being, a person who lives in a neighborhood, performs a job, inhabits a culture. Keeping these things in mind will help maintain focus on the longitudinal care of the person and of the community, prevention, health across the continuum rather than episodic, tackling the challenges of disparities, social determinants of health, and fragmented care. In short, there's nothing wrong with having a plan. Plans are good and often necessary, but don't be ruled by them, or you risk being perpetually disappointed. Instead, ground yourself in principles. You've personally experienced how adversity can come overnight and destroy the best laid plans. Solid principles, however, defining who you will be, that will always lead you to a new and sometimes even better place than you had planned. In closing, I just want to thank you all for everything you all have done as medical students, as members of the Geisinger community, and congratulations once again.